Okay, hi everyone, and welcome to our webinar on clinical findings in psychedelic therapy. My name is Sharon Bella, and I'm a respiratory therapist here at Field Trip's Toronto Clinic. And today I'll be facilitating a conversation between our nurse practitioner, Monica Mina, and one of our psychotherapists, Sabina Pillai. But I also really quickly want to shout out some of our amazing clinic team members that work with the clients at our Toronto location before we get into the webinar. Dr. Joseph DeLeo is our lead psychologist. Dr. Michael Verbora is our medical director. Martha Casamides is another one of our psychotherapists. Judy Zhu is our medical office administrator. Andrew Jordan is our clinical operations manager. And these webinars are organized by Alex Sherman and Brandon Good, who have been doing a fantastic job. So stay tuned, as we'll likely be doing more webinars once we open the New York clinic this summer. So just going on to slide number 2 here. Okay. Field Trip Health is a different kind of mental health company. We combine the science of psychedelic medicine with evidence-based psychotherapeutic approaches to collaboratively work with individuals who are searching for new ways to work through their treatment-resistant depression. Through this integrative approach, we are aiming to revolutionize the field of mental health. Next. So here you can see this is our front area space, and we're going to be launching some more clinics, which is exciting in the States. First one being New York this summer. Also have plans to launch clinics in Chicago and Los Angeles, but this webinar will be based on our Toronto clinic. But yeah, purpose-built clinics so that clients have a calm and inviting environment to go on a journey within. And the next slide, perfect. So these are some of our treatment rooms. As you can see, very calming, and we have a lot of plants at the clinic. So I'm sure you've probably seen it on social media as well. Okay, so a little bit about the presenters today. So as I mentioned earlier, I'll be facilitating this conversation today. My name is Sharon, and I'm the respiratory therapist at the Field Trip Toronto office. Outside of my RT role here, I also help with the Field Tripping podcast hosted by one of our founders, Ronan Levy. So if you haven't listened to it yet, would highly recommend it. I study at the Mitchell Institute at UHN and have worked in a variety of settings spanning surgery to community care. And I'm really excited to be a part of this new work that we're doing at Field Trip, which I think is going to help transform the lives of so many people in a positive way. But I'll have now Monica and Sabina go into their backgrounds in more details before we get into the presentation.
Sure. So hi, everyone. My name is Monica. Sharon mentioned I'm a nurse practitioner here at Field Trip, and I'm so excited to be able to talk to you all about this novel treatment that we're doing here. I started out after I developed a passion for an advancement of mental health treatments. I've worked in a few different settings, but where I began to develop my passion for mental health was in my role as a nurse on a trauma and neurosurgery unit in downtown Toronto. I took care of a lot of patients who were admitted to hospital with serious injuries after they had attempted to commit suicide. The hospital staff would care for the physical injuries, and they would care for the mental health issues as well, with things such as antidepressants and various forms of therapy. And for some, this worked, but unfortunately for others, it wasn't enough. I wanted to help people in a different way than I already was, so I decided to become a nurse practitioner. I found myself researching psychedelic medicine one day after coming across one of my patients who was microdosing with psilocybin. And after I started to read a bit of the research that was out there, I became intrigued, and I knew that this is something I wanted to be a part of.
Hey guys, so my name is Sabina. I'm a registered psychotherapist, and I have a master's in clinical and counseling psychology. I've been working in mental health for close to 10 years, doing research in mindfulness meditation, addictions. I've been doing a lot of facilitation and individual psychotherapy for a number of years. So I began my mental health career with the belief that novel approaches, such as mindfulness meditation, can fill a gap in current treatments for mental health disorders. So I previously worked with individuals who are dealing with trauma, addictions, and borderline personality disorder. So the foundation of the therapeutic work I do involves creating a genuine and safe relationship with my clients so that we can work collaboratively, so they feel safe, so that they feel safe enough to kind of learn new ways of being and new perspectives. Ultimately, what we're trying to move towards is more acceptance, more self-compassion, finding a balance between acceptance and change, between doing and being, right? As a person, I'm oriented towards growth. I take a strengths-based approach to working with my clients, and I think that psychedelic medicines have a tremendous potential to facilitate a deeper healing process in this regard.
Amazing. Thank you, guys. Thank you both. So our next slide here just shows a bit of our process. So as you may know, we offer psychedelic-assisted psychotherapy, with ketamine being used as a facilitator to help clients get into some deep psychotherapeutic work. First bubble here, consultation, involves a 3-step process to determine a client's appropriateness for our program. Next bubble, preparation, happens both formally at a session and informally. We encourage clients to continually prepare before each session, as the mindset that they bring into their session really influences their experience. Treatment involves 2 exploratory sessions where the client will receive ketamine, followed by 1 integration session that helps crystallize the information and insights learned from their psychedelic experience. In total, there are 6 ketamine exploratory sessions and 10 psychotherapy sessions, and the process takes approximately 4 weeks to complete, but it varies in between different clients. And beyond, we'll discuss that a little bit more towards the end of the presentation, but our program does give people the necessary tools they need to integrate their psychedelic experiences into their lives, but our services go beyond the 4-week program. Next. So Monica, do you mind providing us with a brief intro to ketamine?
Sure. So ketamine is a synthetic drug. It was designed in the 1960s, and it was classified as an NMDA receptor antagonist. Its mechanism of action isn't completely understood, although it's thought to have an affinity for multiple receptors in the brain, including NMDA receptors and the AMPA receptors, among others, which in turn works through the glutamate neurotransmitter system. It's theorized that the action of binding multiple receptors begin a cascade of events that work together to lead to this neuroplasticity type changes that we're seeing, as well as antidepressant and anxiolytic effects. Ketamine became a very popular drug during the time of the Vietnam War, and it was actually declared an essential drug in 1999 by the World Health Organization. However, it was listed as a Schedule III drug, largely due to its use in the rave and club scenes at the time. However, ketamine is used safely every single day in settings such as the emergency room, the operating room, dental clinics, and veterinary clinics. It's a really interesting drug, as in high doses, it serves as an effective analgesic and anesthetic. And in sub-anesthetic ranges, it's shown to have remarkable antidepressant and anxiolytic effects. It's known as what we call a dissociative anesthetic, which is when we give it at sub-anesthetic doses, allows for an individual to dissociate from their normal thought patterns. It's been described to produce visual and auditory hallucinogenic effects, out-of-body experiences, along with some abnormal sensations. And actually recently, the FDA has approved an intranasal spray of ketamine, which is called Spravato, which is being used as a rapidly acting antidepressant, which is the first of its kind. In our Toronto clinic, ketamine is administered by a lozenge, and in some of our other clinics, it will be administered by an intramuscular injection. The experience typically lasts anywhere between 45 to 90 minutes, give or take. However, we also do believe that the drug of ketamine is only a portion of what we're doing at Field Trip that is so remarkable. We think that when given with the intention and the assistance to process the experiences, it acts as a tool to gain an understanding of a different perspective that the client may not normally have access to. So the drug plus the therapy is the prescription here.
That's amazing. Thank you, Monica. So here on this next slide, there are a couple of articles if you'd like to read more on ketamine and its antidepressant effects. We'll have these available after the webinar anyway, for if you want to download it. But Monica, do you mind talking a little bit more about how long the effects last and why there are limitations to the ketamine-only model?
Sure. I think first it's really important to point out that the amount of long-term studies on the duration of antidepressant effects are limited. We have to keep in mind that the research behind ketamine's use as an antidepressant is relatively new. Most of the research started in the years about 2000 or so. However, the literature that we do have, and I refer you to that top study there by Singh et al., among others in the literature, state that antidepressant effects can be seen for several weeks to months after the treatment protocols, which are similar to the protocols that we use here at Field Trip. What I've noticed in the clinic so far, though, is that everyone is very unique, and how long the antidepressants will last are also unique. Some individuals may not require additional ketamine sessions, and others may require some less frequent administration, such as maintenance or booster dosing. The ketamine-only model, while still having benefit, I believe does not have the same value as having a medication that's used as a tool to be better equipped with the work that they're going to have to do in a therapeutic sense. This is discussed in lots of literature from authors like Krupski et al. And Dorr et al., which we can provide those research if anyone's interested as well.
Amazing. Okay, so I guess our next slide. So now just narrowing in specifically on the Toronto clinic without giving away too much without giving away any confidential patient information, can you share some high-level demographic findings?
Sure. So as you can see on our slides there, our gender breakdown is split very evenly at 50% of clients who identify as male and 50% who identify as female. The average age of our client at the moment is 40 years old. And while most of our clients are local to the Toronto and the GTA, we do have clients that are coming in from out of town and out of province to seek our services. I think it's really important to note that our clients are people from varying ethnic backgrounds, socioeconomic backgrounds, from working professionals, retirees, and students. So I think that really speaks to the need for an alternative in mental health care in almost every type of sub-demographic that you could name.
Yeah, it's so true. And just on to our next slide here. How do you decide what dose of ketamine you're going to administer to clients?
That's a really good question. So a lot of the literature is focused on the IV and intramuscular dosing. But what the literature states is that we're aiming for a range of between 0.5 milligrams per kilogram. What we've learned in the Toronto clinic so far is that there's an optimal doses for each individual. So most clients have what I call a sweet spot. And usually by using a start low and go slow approach, we're able to find a dose that works best for each unique client. But generally, as you can see in the chart, doses range from about 200 milligrams to 400 milligrams sublingually. And we're mindful that at higher doses, ketamine is an anesthetic. If you've read anything about ketamine in the literature or IV or IM dosing, that might seem a bit high to you, but it's important to know that when we administer ketamine in the sublingual route, only about 30% of the drug is bioavailable for the body. So we compensate for that with these higher doses. If we compare the IV and IM doses, it's about the same amount of drug that's actually getting into the body. And a really important thing to note about this is ketamine and its effects will vary from person to person and even individually between sessions. So one of the common misconceptions I hear from clients daily is that they want a higher dose so that they can have a greater psychedelic experience, which isn't always the case. Anecdotally, I can tell you that among most clients, even with the same doses, they have completely different experiences, which speaks to other factors such as mindset, and we will discuss a little bit about that later on.
Yeah, so are there any commonalities between dose and side effects?
Yeah, that's a really good question. So I think if you go to the next slide there, we have a little bit of side effect data for you. So in our Toronto clinic so far, our most frequently reported side effects tend to be headache, nausea, and vomiting. And from our experience, we don't necessarily see that side effects are relational to dose. So as you can see, most of the higher reported side effects are actually in the smaller dose of 200 milligrams. And why that is likely is multifactorial. However, my suspicion is that typically it's the starting dose for most clients, and they're just getting used to the medication and learning how that typically will affect them. Often clients will say that they felt nauseous on their first dose, and usually when they do describe those type of symptoms, for the next couple of doses I would normally pre-medicate, so that may be contributing to why the side effects are higher at a smaller dose. But there doesn't really seem to be much in the sense of gender correlation or dose correlation at this point.
Okay. So now we'll have Sabina do some more of the talking at this point. So for the next section, I'm going to be asking a few questions based on themes that we think might be beneficial to those listening today who are interested in either hearing more about our Toronto clinic findings from both a medical and a psychotherapy perspective. So the first question will be, if someone is interested in participating in our program, what do they need to know, and what do their medical providers and therapists need to know about our approval process? Keep in mind, we're discussing Toronto clinic here, so if you're watching this from the US, we'll also be creating webinars hosted by the clinical team in New York and LA once they're launched.
Okay. Sure. Go ahead, Sabina.
Sure. So, I think it's important for clients to know that we approach our intake with a holistic understanding of the healing process and the factors that are important to support that process. So while we know that ketamine can lead to a reduction in symptoms of anxiety for some, ketamine-assisted psychotherapy can lead to temporary increases in symptoms for some folks as they work through long-standing issues. Okay? So the only way out is through. And we don't see this necessarily as a negative. We see it as an essential part of the healing process. So basically, clients need to be ready, psychologically ready, and not just medically ready to engage in the, at times, challenging work of psychotherapy. So using psychedelics in this particular context can lower defenses and barriers that serve an important protective function for a long time. So it creates an open, emotional opening, shall we say, which can be both beneficial and it can be a little scary. So, it's helpful for clients to be equipped with a level of internal resources and external supports in order to obtain the greatest benefit from our program. So psychedelics are not a panacea. There are so many other factors that go into the healing process. So we approach our intake process in this way as we're aware of the limitations of this type of treatment and strongly believe in engaging in best practices within this emerging field. So it's important to know that just because we may have to decline certain individuals at one point in time doesn't mean that they won't qualify at a later point. We are an adjunct service for treatment-resistant disorders. So you may have to seek out, for example, a primary therapist, trial new medications, or demonstrate an ongoing commitment to your mental health in other ways. If you are interested in our offerings and want to learn more, please reach out to our team and we will walk you through the very thorough intake process that we do.
Yeah, I think just to go off a little bit of what Sabina was saying, I think really our approach to assessing if clients are fit for our program is through a multidisciplinary and team-based approach to admitting clients. So there are multiple points of evaluation to review and ensure client safety. Client safety is always the focus of our discussions. So first, the client would see a field trip psychiatrist to ensure that the client would meet the need for our criteria. And then our psychotherapists and our psychologists review the client's chart, and then the medical team as well review for any medical contraindications for treatment. Once the client's determined to be safe and appropriate, then they meet with a psychotherapist to discuss goals of care and to prepare for the upcoming journey. So from a medical perspective, ketamine's very safe, as I discussed earlier, but there are certain contraindications to be cognizant of. So typical contraindications to our therapy include obstructive sleep apnea in a moderate to severe type of range, untreated or very poorly controlled blood pressure, hypertension, any severe heart disease, any uncontrolled hyperthyroidism, severe liver or renal dysfunction, pregnancy or possibly having a pregnancy, and breastfeeding as well as obesity. Other contraindications include any active or significant past substance abuse, any recent traumatic brain injuries, very acute suicidal ideation. There is some evidence out there to support not as acute suicidal ideation, that is, ketamine is a good treatment for that, as well as some medication risks, like things like chronic benzodiazepines or opioids, certain personality disorders and psychosis or a history of psychosis, as well as mania and an allergy to ketamine. Those are typically the medical contraindications that would exclude a client from our program.
What benefits and issues do you see with the medicalization of psychedelics? There are a lot of different ways to look at this. Do you mind sharing your perspectives?
That's a great question. So generally, there are several benefits and limitations to the medicalization of psychedelics. So some of the benefits include the use of evidence-based treatment approaches. As a clinic, we're always trying to capture data and client feedback that helps us refine our practices so that we meet our clients' needs better. There's also increased safety. As adverse events can occur for certain individuals, having trained and experienced medical professionals and psychotherapy staff on hand to manage these experiences has been very important, as we've seen in the clinic so far. So being able to capture quantitative and qualitative data can demonstrate the efficacy of these medicines and have allowed these treatment approaches to become an increasingly valid and legitimate tool to address treatment-resistant mental health disorders. So one of the limitations, however, is the cost and accessibility. So there are many populations that would benefit from this treatment that are not able to do so at this point in time because it can be costly. So I will say that, however, we at Field Trip Health are working hard to make this treatment relatively affordable and have it covered by our insurance, if at all possible. So this is an ongoing process that we are working on and will evolve over time. Another issue I see with the medicalization is that it's very difficult to have enough trained clinicians who are experienced and able to work with and meet the needs of different populations that exist outside a dominant paradigm. So oftentimes, access to training in this field is a barrier, and it's very specialized training that you need to be doing this work in a formal setting, right? So at the same time, hopefully Monica can maybe talk about the biomedical model of care and how that's evolved over time to incorporate more of an integrative approach to mental health and well-being.
Yeah, absolutely. I think, the biomedical model of care really focuses on purely biological factors that exclude the psychological, environmental, and social influences. So it's really considering to be the leading way that modern healthcare is delivered in most Western countries. However, I do think that there is a shift that's starting to occur in healthcare. I think the focus is becoming more of a holistic approach to care. I think as a nurse and as a nurse practitioner, I'm more trained in a nursing model of care, which really positions me well to incorporate the biomedical and the biosocial models of care as well. So this really emphasizes the importance of incorporating a person as a whole, with the mind, the body, and the soul at the forefront of any treatment plan. So I think this is very much in line with medicalization of psychedelics, as having this mindset allows an individual and practitioners to assess all facets of a person and determine if alternative treatments to traditional care may have benefits. I think a really important distinction to talk about when we're discussing the medicalization of psychedelics is we're not talking about, a group of friends taking mushrooms or MDMA at a party, but instead we're really using these as medications with an intention and a therapeutic benefit with support to do so. So I think acknowledging the importance of the social and environmental context that's leading to these beneficial outcomes is what we're trying to do when we're considering set and setting of these experiences.
Yeah, very well said. So now, I guess, talking about the importance of set and setting, what are considerations that can significantly impact or influence the quality of a session and allow clients to get the most out of the program?
Yeah, so that's a great question. I think from a medical perspective, set and setting can include a few things. So things such as preparing your physical body for your upcoming journey is important. Ensuring that the client has a really good night's sleep beforehand, the night before, eating a healthy meal the day before the treatment, and following the journey we have found to be really helpful in our Toronto clinic experience. Knowing that the client is to fast for about 4 hours before their ketamine sessions, it might be beneficial for some to eat later on in the evening before their treatment, say if they have an early morning appointment, or if they have a later appointment, perhaps waking up a bit earlier, so that they can eat something maybe 4 hours before not 4 hours, but a bit before the 4-hour fasting period. Set and setting can also include giving space for yourself before and after the treatment as much as possible. So when possible, giving yourself time before coming into an appointment instead of rushing from work, or having a person who can pick you up from appointments that's flexible, so that you're not stressed and worried about others waiting for you and taking their time. As you saw in earlier slides, some individuals may experience some adverse reactions, and those can really influence mindset. So it's very important to communicate with the therapist, during the journey and the medical team during the journey, so that if the person does experience any side effects, that we're able to medically intervene to limit the effect on mindset as much as possible.
So true. Sorry, go, Sabina, continue. Yeah.
I was just going to add, a psychotherapy perspective to this. I think we're asking questions about the larger context that supports positive outcomes in a treatment program like this. As Monica mentioned, context matters and influences the experience in very real ways, right? And this is known through set and setting. And if you're familiar with psychedelics, you will know that term. So when we think about what we're trying to do at Field Trip Health, how are we trying to create the right context for a meaningful experience to occur? So I think we need to understand what the healing journey looks like, right? The healing journey doesn't happen in one session. It happens over the course of 6 sessions, right? Each session is going to be different. The effects of the medicine are variable. Doesn't mean that they're not valuable, okay? There may be some sessions where you feel relaxed and open and you feel like it's easy to talk, and other sessions that are deeply psychedelic, right? Both of those experiences have value. So what we've seen in the clinic is that, there might be several factors that are related to positive outcomes. So when it comes to clients, the clients who have some courage and willingness to face emotions and face difficult past experiences tend to benefit, having a readiness to let go. There's a lot of work involved to getting to a place in your life where you feel comfortable and you trust enough to let go. Having openness to this experience, like I said before, it's not a panacea, it's not a silver bullet. Okay, there are multiple factors that influence outcomes in this program, like any program. Okay, but at the same time, psychedelics have an incredible potential to create that opening, like I mentioned, to do that hard work of therapy. So some clients have internal resources and supports outside of this program, I think is really important. Also having reasonable expectations, right? If you come into a psychedelic-assisted program thinking that you're going to reset your brain or forget or avoid painful things, you might not get what you want out of this, right? So I think it's important to see this as a journey that happens in our clinic, a journey that happens in between sessions, a journey that happens in the course of a person's life, right? And I also see some therapeutic factors that are really important. So the therapeutic relationship is really the foundation of the work that we're trying to do here. So trust, safety, genuineness, helping clients identify their own agency and strength that they already have, right? Empathic attunement, presence, modeling healthy behaviors, modeling healthy relationships, modeling what openness looks like as well. And when it comes to the clinic, we have a really safe, warm, inviting clinic space. And, there are a lot of plants, as you saw, a lot of soothing scents, natural lights, comfortable chairs, blankets, music. Clients have indicated that these factors have played a significant role in their feeling of safety and their ability to let go, right? So that's my thoughts on the psychotherapeutic lens on set and setting.
Amazing. Thank you, Sabina. Okay, so do you guys mind talking more broadly about some outcomes that we've seen in the clinic? How do we know that clients are experiencing benefits from our program? What are considerations for patients who are wanting to return to our clinic after the program has been completed? Sabina, do you want to go ahead?
Sure. So, we use empirically supported measures that are administered at regular intervals to track clients' progress during their time in the program as well as beyond. We are also kind of capturing qualitative feedback from clients as well. So just broadly speaking, some positive outcomes that we're seeing already include increased mindfulness. So what that means is increased present moment awareness, increased feeling of and being able to be present, less distracted by your thoughts, increased metacognition. So what that is awareness of your thoughts, and some distance from them as well. We're seeing increased self-awareness, increased self-compassion. And I think that's a big one, right? I think we all want to find ways to accept ourselves as we are. And that's sometimes the biggest work that we have to do. We're also seeing, for example, increased cognitive flexibility, increased cognitive, contact with emotions as well. Being able to connect the mind and body, because a lot of clients sometimes feel like they're stuck in their heads, and it can help to start feeling your emotions again. So accepting oneself, accepting one's past experiences, reduction in self-evaluation and judgment, decreased rumination, like I mentioned, and this feeling of space between your thoughts and emotions, which allows for that cognitive flexibility, and allows clients to kind of move flexibly through the world, where they may have felt stuck before. And also what's really exciting is that now we're coming up to the 1 month mark for a lot of our clients who have finished the program. And we're seeing that there's an even further reduction in symptoms beyond the program. So I think that's really exciting.
Yeah, I have to agree with you, Sabina. I think seeing some of those results coming in have been extraordinary. I think, people are more than their scores are showing, but the scores are really kind of showing us what we already have been seeing in just a more crystal clear way of seeing what we're doing is actually having benefit for some. I think one of the other things that I find really interesting coming at this from a very medical model is some of the outcomes that we've noticed in the clinic, besides the psychological outcomes, have been a reduction in a lot of chronic pain. So we've seen in the literature trials that look at ketamine's effectiveness in pain reduction. And although it's not a primary focus of our clinical practice here at Field Trip, we know that clients who experience mental health conditions, such as depression, are often living with other medical issues, such as chronic pain. And sometimes this can become a really, a cycle where, you have pain leads to depression, and it just continues in this circle and cycle. So I've had multiple clients tell me that they've noticed a reduction in some of their chronic pain. So changes to the physical body such as this really add to the overall psychological benefits as well. And then Sharon, you did ask a little bit about clients who want to return to our clinic after the program's completed. So I'll just generally walk you through how that works. So when clients do finish the program, we're always reevaluating with responses to our metrics. And it's done at set intervals. So clients are always able to reach out to us if they feel like they are in need of a requirement of a maintenance or a booster type of session. And that decision isn't taken lightly. It's something that we talk about with the medical team, with the psych team, and we really determine if there's a benefit to additional ketamine sessions, and we need to ensure safety. So typically they'll be reevaluated with questionnaires at 1, 3, and 6 months after completion of the original protocol. And if they do require more ketamine exploratory session, these typically occur between 1 to 3 months or so after the original protocol is complete.
Great. And how can clients better support their own journeys beyond our program?
So, an important part of our program, our integrative psychotherapeutic approach to treating clients involves 2 aspects. So one of them is motivational interviewing to help clients find their own agency and their own reasons for wanting to change. And the second part of that is incorporating something called behavioral activation. So this is where we help clients identify their own values and help them translate their values into action, really. So, when you come into a psychedelic program like this, you're going to have a lot of insights, right? And we want to find a way to bring that into your life so that whatever you're realizing in your time here, you can carry forward beyond that, right? So we want to try and translate, profound and sometimes ephemeral insights into value-based actions within our program, so that when clients leave, they can take concrete actions to start living a life that's in line with who they truly are, right? So, some of those actions might look like, being more intentional with giving themselves time and space, to be gentle with themselves, to practice awareness, spend more time with friends and family. Our program is a slice in time of a person's overall journey, and it can be helpful to access ongoing support as well. For example, in the form of psychotherapy, counseling, meditation, mindfulness groups, fostering connections within your community with friends and family. Also, the preparation work that we emphasize in our program is just as applicable outside of the program. And we recommend clients continue with the same activities that help them take care of themselves while they're here.
Absolutely. I think going along with that is continuing to optimize their physical health. So after you leave the program, it's not this, you've taken a medication and you're cured and you're better. It's always going to be a work in progress. And I think optimizing that physical body with things like ensuring a healthy diet, getting physical activity, and prioritizing working towards your own individual goals is really important. So we know, like I said earlier, the mind and the body are connected, and the goal is to achieve an overall holistic sense of health. So an individual needs to be working towards whatever it is that their own individual goals that they've set out for themselves are.
Yeah, thank you guys. That's great. And now I want to ask, what takeaways have you both noticed from working in the clinic? Did anything surprise you? What has been a personal impact that you felt doing this work as a professional in this new space? Would love if you could both share what's been rewarding or exciting for you that might inspire other professionals who are interested in this space.
So I see this as human-centered, trauma-informed work, and I see myself as a witness to the unfolding that may be happening for the person in front of me in this little slice of time. It really is a privileged and humbling experience to hold that space and be trusted to do this. So seeing clients have the courage to face their painful experiences and allow themselves to experience moments of joy or self-compassion that they haven't felt in so long has been incredibly rich and rewarding work as a clinician. Seeing clients transform in such a short amount of time has reaffirmed my confidence that this is a novel treatment approach that's filling a gap that's much needed in our current mental health model. So, like I said, there's no magic pill, but seeing how psychedelics can catalyze an intensive psychotherapeutic process has been exciting for me as a clinician. I have been working in mental health for close to 10 years now, and I haven't seen anything with this much promise. So we're learning so much from our client. Every single client who comes through our doors really teaches us so much. So I'm looking forward to refining our protocols to reflect best practices in this field as they become more elucidated, right? I will say, though, that to be able to do this in a beautiful clinic space and with an incredible team of people who genuinely care and genuinely want to help improve people's lives, I think that makes this all the more sweeter.
Absolutely, I agree with you. For me, I think one of the things that have been so profound is just being able to talk to the clients and witness firsthand the impacts that this is having on people. It's one thing, like I said earlier, to read articles and see on paper that subjects in research studies reported decreasing depression and anxiety scores. But seeing what that actually looks like in people's lives is extremely rewarding. Whether the effects have been subtle, such as clients saying, they have a stillness and a calmness in their thoughts that maybe they haven't had for years. Or bigger changes, such as, feeling this pure sense of joy that they haven't maybe since childhood, for example, allows me as a practitioner to feel like the work that we're doing here is meaningful and that we're actually making a difference. I'm inspired every single day by the clients that I work with, the courage that they have to pursue a treatment like this and do the work that's required in the program to reach their mental health goals is not something to be glossed over. So if there's any clients that are listening who have gone through our program, I really want to take the time to commend you for all of the strength and courage it took to start taking those steps to working towards your mental health. I also think one of the things that I found most interesting working here is being able to be exposed to a very different type of treatment. Sorry, there's some sirens going outside our windows here. But I've been able to have exposure to a world that is really not taught in nursing school. I don't think it's really talked about much in medicine from what I've heard from my medical colleagues. So being able to have a platform to talk to other practitioners, talk to people who may not know a lot about psychedelics. I know when I left the hospital, a lot of my colleagues were very confused and they hadn't heard about psychedelics being used in a medical sense at all. So being able to sit down with people and talk to them about what we're doing and how that's actually benefiting people has been rewarding for me as well. And I also agree with what Sabina said. Our team here has been fantastic. It's really refreshing to be around a group of people who care so much about individuals' mental health and are really working to the bone to get to, mental health reform and really making a treatment that makes a difference.
Yeah, no, it's beautiful. Thanks, guys. And I totally agree. I mean, it's so rewarding to work here. It's refreshing to work alongside such kind human beings. It's just great. We love working here at Field Trip. Now I'm just gonna take a couple of questions from our chat. Like, we won't be able to answer all of them, unfortunately, but if there's any that we haven't answered, feel free to email us at hi@fieldtriphealth.com and someone from the team will reach out. So one of the questions that we'll take here, if you guys are okay, are we okay with time? Mm-hmm. Yeah, okay. Okay, so do you provide any post-trip integration work with patients? To what extent ketamine requires integration versus other psychedelic compounds?
That's a great question. So I'm happy to answer it. So the way our program is structured is 2 ketamine sessions and 1 integration session. So, after each ketamine administration, we actually have some time, essentially a full therapy session to discuss your experiences. And I think integration and preparation are the most important parts of a psychedelic experience, of any experience in life, right? It's important to know what you're getting into and also to digest it after, because, sometimes it can be very innocuous, and other times it can be really powerful, okay? And anytime, it's important to just talk about it, what the experience has been like. If you feel excited, if you feel relaxed, if you feel disappointed, this is all valuable clinical information that we can work with.
Yeah, that actually goes well. Someone else had asked, if you find the treatment not to work after, are you able to withdraw from the treatment? That kind of goes to that point, like, to work through. Sometimes the disappointment is actually very valuable. So thank you, Sabina. Monica, did you want to add anything to that, or should I go to the next question?
I think I just want to echo what Sabina said. I think, as you were saying, disappointment is a very valuable emotion. I think one of the things that I was taught when I started here was you may not get what you want, but you're going to get what you need. So sometimes I found in people who maybe feel a sense of disappointment, maybe in a session, it wasn't the same as it was the time before. As I said, there was such a variability even between people in the same doses. Those have really led to profound therapy sessions where we can really unpack some of the issues about, the need for things going a certain way. So I think every experience that a client has, whether it be positive or negative, is important and it's valuable and it's rich. And don't get upset if it's not what you want. I think it's better to come into this with a very open mind. But if you're coming in with a very narrow set of expectations, the reality is what can happen afterwards is still great.
Thank you. Okay, so next question. Would you be prescribed ketamine going forward after the sessions are completed?
So I can take that one. So outside of our setting in the clinic, you would not be prescribed ketamine outside of this setting. But in the sense of, potentially after you complete the treatment protocol, which is the 6 sessions of ketamine, as I said earlier, we do reevaluate people at, about 1, 3, and 6 months or sooner if someone reaches out to us. And potentially there is some room for a maintenance or a booster type of dose, but we do not prescribe anything to leave our clinic. I think maybe this question is referring a little bit to the intranasal spray, the Spravato, which is not something that we do at the clinic here, but that is an option I think available.
Okay, great. Well, thank you. How will depression be managed going forward once treatment is completed? That's another question we received in this chat.
So I'll take that one. This is part of the reason that we encourage ongoing psychotherapeutic support. This is an adjunct program, right? I think it's important to recognize that even if you do have a lot of insights and changes that happen during this program, it takes a while to let that settle. It can be a lot to do all this work. It's important work in the span of 3 to 4 weeks, right? That can bring up a lot of stuff. So how we set people up for the future is, like I mentioned, finding ways to integrate their insights into value-based actions, help clients, recognize the barriers that might come up, triggers that might come up. And oftentimes clients are able to identify those things in our program. So, finding ways to manage that is important. It may look like ongoing therapeutic support. It may look like, having a regular meditation practice. It may look like keeping up with your medication as well, right? There is no one size fits all, and there's no one answer. Every person is going to be different, but it's important to consider what the after looks like. And we're building a list of resources in the community that can help clients, access supports that are understanding and aware of these types of treatment programs, because not every clinician is understanding or open or knows what it can be like to engage in a program like this.
Thank you, Sabina. And Monica, are we good to go to the next question?
Yeah, I think Sabina covered that very well. I don't really have anything to add to that.
Okay. Next question. I've heard of the term K-hole. Is this experience likely to occur from a dosage range offered at Field Trip? How does S-ketamine compare with other psychedelics like psilocybin?
It's a good question. So, there is a distinction between ketamine and other psychedelics such as psilocybin. I think one of the largest differences is the timing. So psilocybin effects can last much longer than the effects of a ketamine type of session would. So like I said earlier, about 45 to 90 minutes, give or take, whereas psilocybin typically lasts quite a bit longer. In terms of a K-hole, so a K-hole, for those who may not have heard that term before, is a term that's used in a lot of the recreational type of use. It really depends. It's hard to say if the dose I give you today, it may be different. You may not have a K-hole, but someone else may have experience that really feels like they're heading down a tunnel, is how I've heard K-holes described. Heading down a tunnel, not really sure where it's going. And I always tell people, don't be afraid of where that tunnel is taking you. Just enjoy the ride. See where it goes. See what kind of thoughts come up in your head. So there's nothing to fear with a K-hole, okay? Just buckle up and enjoy. And if it's too much, we're here for you to support you. So I think that's what I would say. Sabina, anything to add there?
Yeah, I will say that, clients have described that experience of the K-hole to actually be very freeing, much more relaxing and peaceful than you might think it might be. So that's what we've heard. And keep in mind that this is why we approach dosing in the way that we do, right? We start low and slow, we see how you respond, and then we go from there. If the lowest dose that we start with, feels like too much, we can go even lower, right? And if that feels like, I feel confident, I feel comfortable, we can slowly go up from there. I will say that those experiences tend to happen at the higher doses, and we will kind of monitor your experiences and adjust accordingly.
Okay, thank you, Sabina. Are you guys okay to take a couple more, just a few more last questions? Yeah, okay. Okay, so this, I understand that psychedelic-assisted therapy is not yet available outside of trials, but I want to know where the conversation is when deciding to administer either psilocybin or LSD to a patient.
Do you want to take that one, Sabina?
You can take it. Sorry, I didn't actually hear the question.
Yeah, sorry, it cut off a little bit for me as well.
Oh, sorry. Okay, I'll repeat it.
Okay.
Hello, I understand that psychedelic-assisted therapy is not yet available outside of trials, but I wanted to know where the conversation is when deciding to administer either psilocybin or LSD to a patient.
So ketamine actually is available outside of a trial. So what we do at Field Trip is not in a trial type setting. This is actually in a clinical therapeutic setting. So while there are other trials happening, you can have access to ketamine-assisted psychotherapy, but it is not covered right now, generally, the whole program in its entirety by government plans. So it is some of the fee-for-service model. In terms of psilocybin, that is correct, that is only available in a trial basis at the moment. And that really has to do with the legality of psilocybin. It is still illegal to use psilocybin in Canada and in the US, and there is a lot of motion to change that. There's issues on the ballots in the US right now that are trying to legalize psilocybin for medical use. So of course, stay tuned. Hopefully that will be on the ballot, I think, in the next year in the States, and hopefully Canada will follow suit. But you're right, for now, psilocybin, unfortunately, is not available outside of a trial setting.
Thank you, Monica. Sabina, are you okay if I go on to the last one?
Yeah.
Okay, so more of a social justice question. I'm a therapist in the trans and queer community where many folks have treatment-resistant depression. How can we bring these alternative approaches to support communities who are often left out or left behind by innovations like these?
Thank you for asking that question, because I think this is so important, and I think I touched on it a little bit in terms of, accessibility to these medicines. And there's so many groups of people that would benefit from these medicines. And there is limitations to the psychedelic model in that sense, because, I personally worked with LGBTQ community in Toronto for a number of years. I've done harm reduction at Pride. This is an area of mental health that I am passionate about personally. I am hoping that we can do the work to change that. We understand that these treatments are costly. We understand that there are so many barriers for, marginalized and racialized people to be doing this work as well, right? It's important to be able to see queer and trans therapists as well being able to deliver this. Because the only people that are going to understand the nuances of lived experiences are going to be those people, right? So that's something that I'm personally passionate about. I am involved in various groups discussing how we can change that, how we can increase accessibility for racialized and marginalized people, so that this is not just a niche treatment, right? I think that's important, and that's evolving. And I have hope. I have hope that it's going to change.
Beautifully said. Thank you, Sabina. Monica, did you want to add anything? Yeah.
I think Sabina covered it well, but what I will say in general, I think it takes the public and having a sense of advocacy for things that they believe in. We believe in this, and we're advocating for the public as well. But when the general public starts to see things coming up on ballots and trying to get involved in awareness about psychedelic medicine, I think that is going to help the cause even more and make this more accessible. But it's really right now about getting that information out there, making this treatment more mainstream, and we'll do our part as well, lobbying the necessary governing bodies that we need to, and lobbying the insurance companies and things like that. But right now, I think what you're all doing right here, right now is important. You're becoming aware. So thank you all for attending.
That's great. Thank you guys so much. And thank you to all of our attendees. We really appreciate you coming to listen. We love creating these webinars for you guys. So Stay tuned for future ones. And if you have any other questions that we unfortunately didn't have time to get to, please don't hesitate to email us at hi@fieldtriphealth.com. And stay tuned for our next one.
Bye, everyone. Thank you all.
Bye.